You're watching Extras from the Extension on Eagle Community Television. This show is brought to you by Carico Implement.
Hi, I'm Linda Beech, the Ellis County Extension Agent for Family and Consumer Sciences, and this is Extras from Extension on Eagle Community TV. I have a guest with me today, and maybe you'll recognize Jamie Rathbun. She was here a month or so ago talking about the Prepare Kansas program, and we're delighted that she was able to share that information. Jamie's back today because she is a trained counselor in the Senior Health Insurance Counseling for Kansans program. We call it SHIC for short. And in that role, Jamie works with helping seniors understand Medicare and various health insurance decisions. Well, as we move into October, it's important to talk about Medicare again at this time of year. So Jamie, we're awfully glad you're here to be with us today. First of all, why don't you tell the viewers just quickly the brief overview, what is Medicare?
Medicare is health insurance for a couple different groups of people. It was signed into law in 1965 and became effective in 1966. Medicare is currently the nation's largest health insurance program, covering about 44 million Americans.
Wow, okay, so we're talking about health insurance. And we know that health insurance is complicated, and it becomes more complicated as we start adding all of these parts and pieces to this very large federal program. Well, at this time of year, it's important to talk about a specific part of Medicare health insurance coverage, and that's something that I hear referred to as Part D. So take the mystery out of that. What is Part D Medicare coverage?
Part D is Medicare's prescription drug insurance coverage. So anyone who's eligible for Medicare, who has their Part A and their Part B of Medicare, is also eligible to enroll in a Part D prescription drug plan.
Because Part A basically covers inpatient services, hospitalization. Mm-hmm. Part B is outpatient services, but neither of those covers drugs. And
correct.
As the medical world moves more and more to prescriptions, it's important to think about perhaps whether a prescription drug policy might be important for you. Well, it seems to be a big topic of conversation in the fall. Why do we need to talk about this Medicare Part D at this time of year?
Every year from October 15th to December 7th is the Medicare Part D open enrollment. So that means that as a beneficiary, you are eligible to change from one Part D plan to another plan, should the change benefit you. It's often a good idea to work with a trained counselor, or if you feel comfortable navigating the Medicare website yourself, you can sure go online and look at the plan options and compare the Part D plan that you currently have to the plans that are available for the upcoming year, and make some changes if those changes do seem to be a benefit for you.
Well, so let's say I'm a Medicare recipient and I've got a prescription, Part D prescription drug plan. Do I need to bother with paying attention to this open enrollment time?
I think it's important to always pay attention during open enrollment time, and to definitely comparison shop. I think I've shared with you before how I like to compare this to grocery shopping. When I go to the grocery store, I am a bargain shopper, and I usually buy generic frozen vegetables. So I may use those green beans in soups, in casseroles, as a side dish for my family. And I usually do pick up that generic brand. On occasion, when I go to the grocery store, I may see that one of the brand names is on sale for a cheaper price than what I would get the generic for. So it's always a good idea to kind of keep your eye open and see if there's a better deal out there for you. The one thing to remember about these Part D plans is once you're in a prescription drug plan, you're locked into that plan for the entire year. So it would be me needing to go to the grocery store and comparison shop my green bean purchase, knowing that I am stocking up and buying green beans for the entire year, and am I going to pay a higher price or pay a lower price?
So do these plans really change?
The plans do change from year to year. They, as with any insurance company, have the ability to renegotiate their terms with their beneficiaries, with the drug companies who are providing drugs, and with the pharmacies that provide the drugs to you as the potential beneficiary. So they renegotiate the monthly premium price, so what you pay every month to be a member of that plan. They will renegotiate their deductible. And then also the cost that you pay at the pharmacy counter when you go to pick up your prescriptions. So costs do change from year to year.
And do they ever change the drugs that they cover? The ones that, I mean, if I'm on this set of drugs, my policy should be good for the rest of my life? Is that how it works?
No, that's a very good point to bring up. They often do renegotiate which drugs they are going to cover and which ones they aren't. Maybe you've been on a brand name that has now gone generic and they say we're no longer going to cover the brand name, we're going to cover the generic at a cheaper price. Or as other drug alternatives come out on the market, whether it's a generic or not, they have the choice as the insurance company to say we're going to cover this or we're not going to. So you may, if you do not do your comparison shopping from October 15th to December 7th, you may get a rude awakening the next time you fill your prescriptions the following year. What would be any time after January 1 of 2016 coming up.
So it really does make sense to check into this to see if your Medicare Part D prescription drug coverage is changing or if it's staying the same. You may find that one plan worked this year and a different plan, a different company even, may work better the next year. Is that how it works?
Yes.
This is complicated. So where do people get help?
There are certified counselors. I know right here in Ellis County, a good contact to find a counselor would be to contact the Northwest Area Agency on Aging office, and someone there could put you in touch with a certified SHIC counselor. Some in your local community, or maybe even out in some of the communities that surround the Hayes area.
Right, and like Jamie mentioned before, this information is available to all consumers on the Medicare website, which is medicare.gov. And so if you're comfortable and want to do the preliminary research, that's a great place to start. Well, we certainly want to thank Jamie for being with us today to bring a little light onto the confusing and complex world of Medicare Part D prescription drug coverage. Health insurance is important at any age, and certainly for folks who are receiving Medicare, it is vital to understand your policy and to be aware of any potential changes so that you can choose the best plan for you. Thank you, Jamie. We're glad that you're here to be with us today. And thank you for watching as well. I'm Linda Beech, the Ellis County Extension Agent for Family and Consumer Sciences, and this has been Extras from Extension on Eagle Community TV.
You're watching Extras from the Extension on Eagle Community Television. This show is brought to you by Carico Implement.
Fall is here, and it's a great time to come out and visit Carico Implement in Hayes for all of your fall lawn care needs. We stock and sell a full line of John Deere riding lawn equipment, along with Honda walk-behind mowers and generators. We also offer a full lineup of Steel outdoor power products. If your project requires even more muscle, come check out the lineup of John Deere compacts, tractors, and skid loaders. And don't forget, we have the parts and services to keep you up and running for whatever your fall lawn care needs are. So come and visit Carico Implement for a solution that fits.